the initial discussions that we had in Mauritius about why we came to this topic. So I don't think we need to kind of revisit that. So we'll get started with what your plan is to do. And your SMART aim looks good. Um, I'm reading it out. It says it's specific, measurable, achievable, relevant, and time bound. So it says it's implement adapted surfactant protocol at the JNH NICU. Uh,
Mm.
and the measures, you're going to look at more than 90% eligible infants less than 32 weeks will receive surfactant protocol. That's your measurable goal. And it's achievable because you think you're going to start with the pilot and expand over 6 months. It's relevant because it'll reduce BPD incidence, hopefully by 20% within a year, and it's time bound. So you want to do this by December 2026. So that kind of SMART goal is like it's like an overarching goal, but you need to have a specific goal for each PDSA cycle. So I think what you need to do is with that big goal, you need to break it up into different PDSA cycles, which you have. You have cycle 1, 2, and 3 and 4. So you need to have a SMART goal for cycle 1, um, which is the introduction of standardized protocol. So let me kind of say what I think should be done, and then um, you can chip in. So right now, you do not have a standardized protocol, correct?
Yes, we do not.
Okay. So you're starting with baseline of 0 basically because there's no baseline. Otherwise, usually you get a baseline information of what you have been doing. But in a way, you can explore this a little further and maybe you can get some baseline information. So right now, if when you say the standardized protocol, what is the actual protocol you're thinking of instituting? Like, what are the elements of the protocol?
So right now, what's being done in our NICU is every baby that's born before 32 weeks, they are given one dose of surfactant. Usually, we try to give them the first dose of surfactant within 1 hour of life. So
Okay.
that's what we usually do. So what we did is we went through the NHS guidelines that actually recommend that when the babies are born, they are placed on CPAP, and then depending on the FiO2 requirement, then the decision for surfactant is taken, and it should be within first 72 hours of life. So that's what we want to implement in our
Oh,
NICU.
okay. So you want to use the NHS guideline for early institution of surfactant within first 72 hours. That's actually a long period. But so right now, I think it would be good to get some baseline of in the last maybe 2, 3 months, how many
Mm.
surfactants have you given to the babies? And what was the average, what was the time for each baby that um, when the surfactant was given? So baby
Okay.
one, maybe like 1 hour, maybe two, maybe 5 hours, maybe three, maybe 18 hours or whatever. I think it'll be good to get some baseline data of what you're doing currently.
Okay.
And you need to probably get enough to give you some kind of a like this is what's going on right now. So go back
Mm.
to maybe 4 months or 6 months of your patient's charts and just note down the time of administration of surfactant, and also see what criteria were used for that. So like maybe if your criteria is CPAP and FiO2, right, those two things. What about babies who are intubated? They probably will get surfactant immediately.
Yeah,
But
those will be
yeah,
getting surfactant quite quickly.
so maybe you can for the last 4 to 6 months make some kind of a data collection form looking at patient information, name, date of birth, gestational age, birth weight, and see when the surfactant, time of surfactant administration, what was the condition before surfactant administration in terms of respiratory support, was it CPAP or intubated? And if so, what was the mean airway pressure or the CPAP pressure that was being there? And what was the oxygen
Uh,
requirement?
yes. Sorry.
Yeah,
Sometimes we just see the chest X-ray, not straight away. We were giving. We just see the X-ray. If there's a grade one or more than above grade two. We decide to give surfactant.
that's
Not
fine.
we put.
So you can just use that criteria. So basically, you can have another column for X-ray evidence, which shows what grade RDS it was. But something that what you're currently doing, I think you need to have that information.
Okay. So
So
just have data collected on that and have
yeah,
like a baseline. Yeah.
yeah. So the data form, maybe right now, I mean, what I'm suggesting, you can add more data elements to it, but just the name, date of birth, gestational age at time of birth, birth weight, and then respiratory respiratory information that prompted surfactant use. So that is either a chest X-ray or uh, CPAP or ventilator uh, and oxygen. So maybe each column, um, one column for each one to see if there was it was based on respiratory support or X-ray or CPAP level or oxygen level or all of the above. So just I can send you an example of a form, but you can probably create one. So each one column for each of those criteria, and then check how many of the criteria the baby met, and then what time the surfactant was given in terms of time from birth.
Okay.
So that will tell you what your baseline is. How frequently are you doing? And because if your guideline, if you're following the NHS guideline, and it says you need to give surfactant as soon as possible, um, at least within first 72 hours. But I think there might be some other criteria within the NHS guidelines in terms of what level of CPAP and what level of oxygen, FiO2. Does it have
Yes.
that?
Yes. So the criteria is if a baby is less than 32 weeks. So an FiO2 of 30 or above should be an indication for surfactant.
Yeah.
A
Okay.
requirement of, yeah.
Yeah. So a FiO2 of 30, and was it a CPAP number as well, like 5 or 6 or some number?
There was no specification when I read about the guidelines, but I think it would be 5 or 6.
Yeah,
We wrote for CPAP a PEEP of 6.
6. Okay, so that's good. And then if they're on the ventilator, that's probably an automatic, right? If they are intubated and if they are
Yeah.
intubated. So 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 it may be it's a little bit of work, but I think needs to be done. So you could go back to the charts and see when the baby went to CPAP of 5 or 6, whatever your criteria is, when the baby went to the FiO2 of 30%, and then when the surfactant was given. You know what I'm saying? So the baby was
Yes.
born in the morning and was needing FiO2 of 25%. Then by afternoon, the baby was on 30%. And then the surfactant was given tomorrow morning. That's like,
Mm.
a long time. So just to get an idea of how quickly when the baby meets the criteria are you giving surfactant in the
Okay.
past.
Okay, that can be done.
Yeah, if you can do it even 3 4 months, you get a baseline of how variable. There may be a lot of variability. Some people may be giving it early, some late, but at least you will get an idea of what your maximum and minimum time is, what your average time for giving surfactant is, from the time the baby meets the criteria. So, and the criteria, probably the best one, easiest one to say is FiO2 of 30% or more.
Yes.
And you can even use CPAP of 6. So so that's one thing. And then I would say if you can create another column for what's called the respiratory severity score, which is basically a product of CPAP and FiO2. So if the CPAP is 6 and the FiO2 is 0.3, the respiratory severity score is 1.8, 6 times 0.3. And most places use the respiratory severity score of 1.8 as kind of the cutoff for giving surfactant. So I don't know if it's in the NHS guidelines, but you can use this as a, because sometimes the CPAP may be 5, and but the FiO2 may be, 40% or 50%. So then that baby is 5 times 5 is 2.5, or 5 times 4 is 2.0. So that RSS is high. Or a baby may be on CPAP of 8 and a FiO2 of 22%. So 8 times 2 is 0.6, 1.6 again. So that is kind of includes both parameters, and you can create a column. So you'll have the oxygen requirement as well as CPAP, and then another column which has the product of both. Because the reason I'm saying is that for future, I think the respiratory severity score may be a good guideline to follow in when you develop your protocol.
Okay.
So do this background data for,
Ushan,
yeah, go ahead.
yes, I wanted to add one thing. In practice, we usually look at X-rays, whether it is grade 2, grade 3. But
Okay.
under correction of my friend, uh, I think according to the NHS guidelines, they don't look at the chest X-rays. It is not among the criteria. What do you think on that for the chest X-rays? We should
Yeah.
include it among the criteria, yes or no?
So I think first you have to study the problem as it is currently there in your unit. So if you're looking at chest X-rays and scoring the chest X-rays for RDS, I would say collect that information also. So and see, because most places have gone away from doing X-rays to make a decision, because it's based more on the clinical picture rather than the X-ray picture. But X-ray picture also helps to make the decision if you're kind of borderline, you don't know which way you're going, and the baby's borderline. So that is how most people are doing it. But again, I would say some places may be putting more emphasis on the X-ray, some places more emphasis on the oxygen. But I think majority are looking more at the CPAP level and oxygen rather than the X-ray. But it's okay to use that as an additional information for the baby if you're kind of borderline.
Okay, doctor.
Um, the thing about X-ray is it's mostly for the babies that are doing not so bad. So the babies that come to our unit that are not immediately intubated. So those are the ones that we wait for X-ray and see what's happening and then make a decision. Whereas those babies that's already intubated, we try to maximize the golden hour. So we'll try to
Yeah,
give them surfactant during that first hour.
yeah, yeah. That's appropriate. I think that's a good policy. But just find out how consistent are you with that policy. Are you doing it all the time or not? If you're doing
Oh
it
yeah, that,
well, then that's good. Then you can move on to the next thing. But if you're not even meeting your own kind of threshold in
yes.
terms of the timing, then there's room for improvement. So first you
Mhm.
need to kind of figure out what is going on. So spend a little time and look at least a couple of 2 3 months of babies that have received surfactant. So you know how many babies got surfactant, and then just go back and see when they started meeting the criteria and when surfactant was given. So if the baby got
Mhm.
intubated in the DR, the surfactant should have been given right away. If the baby
Yes.
got intubated at 6 hours, the surfactant should have been given at 6 hours. But if the baby was, needing more than 30 40% oxygen in the morning and the surfactant was given the next day, then it's too long. Something like that. So you need to kind of first figure out what is going on.
Okay.
Okay. So step one, background information focused on this problem. And then based on the background information, you can see how you want to develop your protocol. Or do you already have a protocol right now?
We're still devising it, like finalizing it. We've discussed with the other consultant,
Yeah.
and still need to finalize it.
Okay. So you can do that in your context, and I will send you a few papers that I've found that have done a similar QI project.
Yes.
And you can use those papers as examples of what you can use as your protocol. So I will send it after this meeting. I will put it on the WhatsApp group, a few papers that have done a similar QI project. So the protocol, I think development would be the next step. So the first step is background data.
Yes.
And then the second step is protocol development. And to do this, actually, you need a team. So one person probably should not do it, and you probably have a team already, but I just want to kind of reinforce that, make a list of all the, actually write it down. It's like you have done the PDF file that you send me. So write down each, like one page for background, one page for background data, uh, whatever you found. And then at the bottom of that, based on your background data, what your summary of the background data is. Like, you have found that your mean time of surfactant was X number of hours after meeting the criteria. And then based on that, you can develop the specific goal, which is to give the surfactant within 1 hour of meeting the criteria, or something like that. So that would be your second page. First background page, second is so first is the introduction page, second is the background data page with the summary of what you found, and then the third page would be a list of team members. Uh, and the team members, I think you need to first develop a team and then develop the protocol. So the team, you may already have it. You have a team leader, which I think at this point is Dr. Mahmood. Is that right? At least that's what
Yes.
was listed here. And then and maybe you can have a co-leader, because sometimes you're not there. Somebody else could be there to take it on. And then you need at least team and a leader and a co-leader, but then you also need members from all the different uh, people that work in the NICU, like doctors, nurses, therapists, or any other people that are involved in the baby's care. And then you need in the team your chief medical officer, as well as somebody from administration, who is basically also sanctioned or approved that this project is good one to do. So at least, even if they're not participating in all the meetings, they need to be there on the paper to say that they have approved your project and are part of the project. So I think make a list of all the people, and I don't know if you need a pharmacist for the surfactant, or whoever else is involved in delivery of surfactant and all that. You need to see anybody who's involved in the process of, from evaluation uh, to delivery of surfactant. In the whole process, the people that are involved, the key people, should be represented in the team. So definitely doctors and nurses who are involved. And then I don't know if you have a pharmacist that gets a surfactant, or the parents get the surfactant, or the hospital provides it. I don't know, whoever gets a surfactant, because availability of surfactant is one thing. And then your catheters and supplies for doing LISA or Insure. Um, just think of all the people and include at least one from each category of people in your team. Um, and only when you have developed the team, then you develop the protocol, because everybody in the team has to be okay with that protocol. It has to be a joint effort, and then you develop your protocol. Is that okay? So that's your next page, which is and write this down. Write down the members of the team, and then also write down your meeting dates, and when you have met and all that, just to keep a record of it. It's always good to keep a record, because you may want to publish in the future, or you may want to use this as an example for some other people. So you should keep a record and keep it some kind of a folder in the unit where everybody can look at it if they want to. Does it make sense?
Yes.
Yeah.
Yeah. All right. So that's the initial part, which is so you got your aim, you got your background information, and then you're going to get a team together. And then based on the team's consensus, you will develop a protocol that you're going to follow. And then you can look at all the available literature data. I'm going to send you some papers. And then your cycle one will start, which is basically introducing the standardized protocol. Um, so development of the protocol is step one with the team, once the team is formed. And then the protocol, you need to educate everybody about the protocol and what you're planning to do before you start the QI. So you need to spend some time making sure that everybody in the unit knows that you're doing this QI and have a tentative start date based on when you think that everybody would have finished educating on, or you were finished educating all the people involved in the unit. So that would again include the other members who are not part of the team, from doctors, nurses, and others. They need to be educated, saying that this is the protocol. We're going to follow this. This is how we're going to do this, and then based on that, then you would. Let me just sorry 1 second. I need to answer this page. Yeah. So then take a little time to circulate the information and even maybe write it down, the protocol, on a piece of paper and post it in the unit in different places so everybody who's not heard it can see what the protocol is going to be. And then only after you've done the education and you feel like everybody knows about it, then you start the QI, the date of initiation of your QI, like implementation date. Okay.
Yes. Yes, sir.
And then you can decide. So this will be the first PDSS cycle about introduction of the standardized protocol. And so you'll start on a particular date and keep the each PDSS cycle maybe 3 to 4 months at the most, because you want to make sure that you're going to find out any problems before it gets too long. So if you're feeling that you get enough patients within 3 months, at least 10 to 12 or 14 patients that would have gone through this that protocol, um, you may want to then review your information after that. So I don't know what your admission numbers are, how many patients you treat, but make sure that you got at least 10 to 15 or maybe 12 to 15 babies done before you review the cycle and see if you're making progress. So based on that, you decide the period of time for the first PDSS cycle. And I would say average would be about 3 months. It could be 4 months. In some cases, if you've got very low census, but 6 to 8 months may be a little too much. Uh, but I will leave it up to you to kind of decide how many patients you get and what your. But you should have at least about 10 to 15 patients in that period of time that you would have treated. Um, so I don't know your census. Do you think what period of time would be enough for the first PDSA cycle?
We can try see for 3 months and see how it's, because our turnover isn't that great.
Okay.
It's it depends on the season. So sometimes we
Okay.
might have like two, three babies preemies in 1 week and then nothing for the next 3 weeks.
Okay. So you can do that, or you can set your target based on the number of babies. So you can say that it's kind of time bound, but based on the number of babies. So you'd say after 15 babies of I have receiving the surfactant, we will review our data, because that'll give you a good number.
Yeah.
And then you can look at your data and see what was achieved with your protocol. And then you can start the next PDSA cycle based on what you found and what went well, what did not go well. So that'll be your first PDSA cycle, and which is basically institution of a standardized protocol. Okay.
Okay. Yes.
So now when you're looking at you also have to now plan about what kind of data you're going to collect while you're doing the protocol. So you already collected the background data. So you need a similar data collection form for the from the start date to the time that you're going to review it. So again, develop a similar form for ongoing data collection. And so for each form, you need to know um, who's going to be the person responsible for ensuring it's accurately filled and documented. So within your team, you need to maybe designate a champion for data collection. I mean, doesn't mean that person has to collect all the data, but that person can keep track if it's being properly collected or not, and then can talk to people and say, oh, you did not do this data, and then also set up a mechanism by which on a daily basis somebody is entering the data. So for example, every day at the end of the day or at the end of the shift, somebody's responsible to say, did anybody get intubated today at gut surfactant? If so, then was that information filled out? And if not, then there was no patient today, then you can put a check mark. So you need to have some kind of a running chart of a daily calendar, or maybe you can put a calendar in your unit and then just put down number of baby surfactant received on that particular day, and then how many, and was the data entered into your data form. Because unless somebody keep track of it, sometimes it gets missed. So what we
Yes.
have done is just to keep a calendar, and each day somebody writes down at the end of the day how many babies got surfactant today, and and then second box was data entered, yes, no. That way you will keep track, and again at the end of 2, 3, 4 months, whatever, you can look and see how well you have been documenting your information.
Is the length of stay on ventilator and the number of babies requiring DOT protocol necessary at this point in time when reviewing the previous folders?
So it depends on your goal for this particular thing. So if you think that you want to also see the severity of BPD that happened, yeah, you can create another column and then put steroids received, yes, no, and severity of BPD at 36 weeks as another criteria. So that's how people mostly judge severity of BPD at 36 weeks, where it's mild, moderate, or severe. And that could be your overall kind of aim, right? So you might want to collect that information for your background. And then on, again, going forward, you may want to keep collecting that information also. So
But
yeah, add a
but
couple of
but that
columns.
but that won't be the outcome if the success of the surfactant rather than just a collection of data. What I mean is like uh, we are aiming to reduce the risk of BPD. So that would be maybe a success or not unsuccessful or not successful rather than just collecting it.
So at this point, I think so the reduction of BPD would probably take a long time. So you just need to keep collecting the data. You can analyze it at the end, because I think you may need to go through 2 or 3 PDSA cycles before you actually see a reduction in BPD. I mean, it'll be great if you can do it right after the first cycle, but it's unlikely that within a short period you'll achieve that kind of result. But it's always good to keep track of it. Do you know what I'm saying? So for each baby that is admitted after you've initiated the protocol, you will keep track. Any baby less than 32 weeks will be in your sheet with the information, baby's, you know, date of birth, birth weight, gestational age. Again, you'll have, when the baby, what criteria were used before surfactant was given, X-ray criteria, CPAP, oxygen criteria, ventilator criteria. And then you'll have the time surfactant was given. And then you'll have subsequently for that baby, did the baby need steroid later in the hospital course? And then the baby get at the 36 weeks, what was the level of BPD? You maybe have also other things that you're collecting, but for each baby that is admitted after you initiate, you need to keep track, because some of that information would be your outcome. And also some of that information you would use for other measures that you will need, because, and in the same database, you may want to collect other stuff. For example, one outcome is how many days on the ventilator. The baby was on the ventilator for how many days. One outcome would be, again, steroid, yes, no. One outcome would be what was the 36-week BPD. Another outcome you said would be, survival to discharge. So those outcomes, again, when you're collecting the data, you're also anticipating what outcomes you're going to report in the long run. So when you develop the data collection form for the QI, you just kind of keep all that information in one place. Or you can use separate forms for separate aspects of the data, but it gets a little confusing sometimes putting it together. So I would suggest just for each baby, on one row, and for each baby, just keep entering the data until the baby gets discharged or the baby dies. And that way you can keep it all in one place. That's just a suggestion. There are many different ways to collect data, and this is what I would suggest, but see what works for you. Does that answer your question, or was the question something else?
Yes, yes, okay. Thank
Yeah.
you.
Yeah. So that would be the main thing. That's the outcome measure that you're looking. But you also have other measures that you're going to also look for. So your process measure is going to be also looking at. So in the process measure is like, so what exactly is your process in this first cycle? The first cycle, you're seeing whether people were following the protocol. Yes, no. So you can keep within that same database that you're collecting for the baby, you can have a column saying, was the process followed as per the protocol? Yes or no. That way, at the end, you can see how many people actually followed the protocol and when did the baby not follow the protocol. And that's a judgment call that you have to make based on what your protocol was, and that for that particular baby, was that protocol followed or not. Because if you may have the best protocol, but if nobody's following it, then it doesn't impact on the baby's outcome. So you need to document how many times the protocol was correctly followed and was not followed. It doesn't matter. I mean, there's no kind of people, you're not going to point fingers at the people that did not follow the protocol. You're just going to say how many times the protocol was followed, yes or no. That's all. Later on, when you review the data, you can say, okay, the protocol was not followed 15, 20% of the time, then you can review why it was not followed. And that's a different thing. But again, with QI, the main goal is not to be punitive or point fingers at anybody. Just look at the process and see how you can improve the process. So that's your process measure. Time from birth to surfactant, you said, was the other process measure. And you're going to document that when you document mode of administration. So you're talking about LISA versus MIST versus Insure versus. So you can have a column in your, again, data collection form for putting the mode of administration and also the number of attempts that were done. So you can document all that in the same data collection form. Just create a separate column for each one of those things that that are part of your process data. So what you're listed here looks like a good way of collecting your process information. And also you have balancing outcomes that also you can collect simultaneously. You know, when you say a number of attempts, then you can have another column saying whether desaturations during the event, yes, no, and then the staff workload and confidence, you may have a separate form. So for whoever does the intubation or administration of surfactant, you may have a form for that person saying, you know, whether that they felt confident doing it, or maybe the team that did the surfactant, you may want to have a form saying that how confident they felt from scale of 1 to 5 for doing that procedure. Uh, and also another form or another way to document workload, and you can have another scale from 1 to 5, like whether you felt that was workload was, you know, low workload or high workload or something like that. So whatever you're saying you're going to be studying, you need to have a form to collect that information for each time that you're giving surfactant. So there's a lot of data collection, but if you don't have too many babies, hopefully it's not too many hours spent in data collection, but you collect good data and then you can analyze it well. So moving on, and time is flying. It's already 45 minutes. So what I'm saying is, so in your place where you're keeping all this information, make place for where you're going to collect the data as either a paper form or Excel form on the computer, or someplace that everybody can access. And what people have done is usually put a paper form where people enter it, and then somebody enters it into an Excel later on. So that's usually the most practical, because not everybody can go to the computer and fill out an Excel form. Most people like to just fill out a paper form. So, but again, based on how you work, you can create all these forms and keep it in the folder in the NICU where everybody can access it, and make sure that again there's somebody responsible for checking if all those forms are adequately completed at the end of each day. That's all. Again, if there's no surfactant given that day, you don't have to worry. But if somebody got surfactant that day, somebody needs to be on top of it to make sure that all that information is filled out. And then at the time of discharge, somebody needs to fill out all the other information, which is basically, you know, how many days on the ventilator, how many, whether the baby had BPD or when the baby dies. So again, make sure that you have some mechanism for keeping track that your data collection is complete. Questions?
No, that's fine. Not at the moment.
Okay. So those are the kind of the practical things. So you have the protocol, which hopefully you'll develop with the team. Then you'll have all your forms and ready to go, and the implementation date set. And then when you start implementing, make sure you have a calendar in the unit that documents how many surfactant were given, and then make sure the forms are all there and somebody's filling it up. So you will do this until your end date, which is either 15 babies or 4 months or 6 months, whatever, whenever that happens. And at that time, then you'll set up another meeting and then go over all the data and see what actually happened. So that will be the end of your first PDSA cycle. And at that meeting, then you will say, okay, based on what your results are, you will decide what the next PDSA cycle is going to be.
Okay.
Okay.
Yes.
All right. So you will probably go through at least 3 or 4 PDSA cycles during a year and a half, um, to really see the full impact of what you're doing. But each step would be hopefully in the right direction. Sometimes, as I said, things don't go right, and you might have to take corrective action. So, as I said, you either adapt what you were doing, or you adopt what you're doing, or you adapt it by tweaking something, or you discard things that are not working. And those would be the things that will happen over the year and a half. And this project will hopefully, at the end of the time, you will have enough information to write it down or publish it or present it at a meeting or something. But also, it'll hopefully help the administrators and other, people in your hospital or administration to see the utility of doing a quality improvement project, and then, that'll how you'll proceed. Um, so that's kind of what I would suggest. Um, as I said, based on what I said, if you can create the necessary forms and send it to me, I'll review it just as a kind of a external person, just to kind of give you my thoughts on it. If you have a local QI champion, you may want to run it by them, somebody who does quality improvement in Mauritius, because it's always good to have a local person. Um, and yeah, that's all I have to say.
Okay, so we do understand there's some background work that we need to start with. So that will try to collect the data. It take some time to get the old folders and go through them,
Yeah.
and we take it from there.
Yeah. So so I think that'd be the best. And as I'm right after this meeting, I will send you. I've got at least 3 or 4 articles that were published based on similar work from different parts of the world, but mostly United States, uh, and how people have done a similar QI project. So use those to kind of get ideas when you develop your protocol,
Okay.
and circulate it among the team members to make sure everybody's familiar with it.
Okay. So we'll just go through it and we'll do some background
Yeah.
work, and then maybe write an introduction and do the background data, and then maybe give you some feedback.
Yeah, give me feedback, and in any case, I think it'll be good to set up some kind of a monthly review of how things are going for your own team, and you can let me know if you're meeting. I can try to join in by Zoom if I'm available that time. But make sure that your team meets at least once a month or once every other month to make
Mm.
sure that this is going properly.
Okay, yeah, that's a good idea.
Yeah.
So I think most of us will be meeting at work because we'll be meeting, but definitely we'll plan a meeting with you because definitely need some guidance there. First time doing it.
Yeah.
So we'll keep you updated and ask for feedback and maybe some more guidance whenever we coming up with any issues when doing the protocol.
Yeah, that's great. And look out for the files that I'm sending. There are about 5 papers that I found that could be, or 4 papers that are kind of similar to what you have done, and I'm
Mm-hmm.
sending them right now. You can review them before you develop your protocol.
Okay.
All right, excellent. Good luck
Thank
with
you.
it.
Thank you, Prof. Hussein. Thank you for your time. We'll get to work and then get back to you as
Yeah,
soon as we can. That'd be great.
yeah.
Yeah.
All right. Have a good night. Take
Thank you.
care.
You
Bye
too.
bye.
Have a good day.
Yeah,
Bye.
yeah. And I will send the
Bye.
recording to this WhatsApp when I get the recording. And
Yes.
people who have not been available to attend can listen to the recording.
Okay. Great.
Yeah.
Thanks. We'll share the recording with the others who couldn't attend.
Yeah, great.
We'll be adding a few people on the group, so there'll be